Hello and welcome to your monthly update from the COVIDENCE UK study for December 2024. My name's Professor Adrian Martineau, based here at Queen Mary University of London, and I'm joined today by several members of the COVIDENCE UK team, as you'll see shortly. So it's now exactly 5 years since the novel coronavirus SARS-CoV-2 emerged in East Asia, and here is an example of one of the early reports documenting the emergence of new viral pneumonia in Wuhan. And 5 years has passed incredibly quickly for me, and in that time, the contribution by everybody who's participated in COVIDENCE UK has been absolutely enormous. A total of 19,981 people signed up to the COVIDENCE UK study. And within the last 5 years, a total of 545,000 monthly questionnaires have been completed. Some 7,500 of you were still completing questionnaires 5 years later in November 2024. And in total, 1,600 of you completed all 55 monthly questionnaires that we've sent you without missing a single one. That adds up to around 580 minutes by my calculations that you've spent answering our questionnaires over the last 5 years. And this is an absolutely massive contribution for which I'm extremely grateful. Now, as you may or may not remember, when you signed up to the COVIDENCE UK study, the original consent was for you to participate for 5 years, and that time has now elapsed. I'm pleased to say that we've achieved many of the goals that we set out to achieve, but regrettably, funding for the main project has now been spent. We do have one recently acquired new grant, which is for a sub-study which focuses on testing for respiratory viruses using nasal swabs just in COVIDENCE UK participants who have asthma. And if you have received an invitation and signed up to this sub-study, then your participation will continue into 2025 as you have renewed your consent to take part in the study, and the monthly questionnaires will continue to be sent to you. However, if you aren't one of those sub-study participants, then today's COVIDENCE questionnaire will be your final monthly questionnaire. So this feels like a pretty big moment for me and for all of the team, given the enormous input that you've made into the study and all the work that we've done on our side as well. And I think it's time really for us to reflect on what we achieved. And first, and I think most importantly, the study has yielded multiple scientific insights into not just risk factors for, but also the impact of COVID-19. And these have yielded 20 scientific papers to date, with 2 more in revision and several others in preparation. The study attracted over £850,000 worth of funding from diverse sources. The study was responsible for the training of 2 PhD students, but also many other students, medical students and scientists, gained considerable research experience from taking part in the study. Not only did your data contribute to our own publications, but we are able to contribute anonymized data to 2 other national studies, one called FOSP-COVID, which looks at long COVID, and another called Precious, which similarly focuses on long COVID. And in real time, before we actually published the data, the results of our analyses were fed back to SAGE, the Scientific Advisory Group on Emergencies, to inform their deliberations. So I think these are very significant bunch of achievements from the data that you have been contributing for the last 5 years. So before we go on to talk about what will happen next, what I'd just like to do is join with my other colleagues from COVIDENCE UK and reflect with them on what they think were the most important and interesting things about taking part in the study. Sheena, over to you.
Thank you, Adrian. Hello, everyone. I've had the pleasure of managing the COVIDENCE inbox, answering all of your emails and sending out your monthly webinars and questionnaires. Firstly, I would like to say a very big thank you for your wonderful emails that you have shared with me. And I have received so many emails over the years where you've shared your amazing stories and incredible moments, from big celebrations and family adventures to your everyday activities. It has been an absolute pleasure working with you all. We are extremely grateful for your continued dedication and loyalty throughout this entire study. And to those of you who have recently signed up to the nasal swab sub-study, your participation is invaluable, and research like this is only possible thanks to people like you who are willing to give their time to help. So once again, thank you very much.
Thank you very much, Sheena, and thanks for everything you've done to keep COVIDENCE UK on the road over the many years you've been working with us.
Thank you, Adrian. It has been an absolute pleasure.
So I'd now like to introduce Jane Simons, who was really instrumental in helping COVIDENCE UK get started and in publicising the existence of this study. So Jane is a health journalist with amazing credentials, so it was a real privilege to have her on board the study. And Jane, over to you.
Thank you, Adrian. And to be honest, it was a privilege to be part of the study. It's not very often that a journalist who's normally writing about the end results of trials gets to see the process from the very beginning. And I think one of the things that it really brought home to me, and it is evidenced by the sort of some of those statistics that you mentioned, was that when COVID first hit, there was a sense of helplessness, but everybody wanted to help. And that was what we were able to sort of really do to connect people with the study, and that with the possibility that simply filling in a survey on a regular basis and potentially providing some blood samples and so on could actually help to answer some quite complex scientific questions. And it's interesting that some of the questions were the negatives. No, this isn't going to necessarily do something, but they are really important questions to resolve. And I think that hopefully everyone who's participated in the study will have, from the experience, maybe opened up themselves to the possibility of taking part in further trials, because that's how we actually get good medicine and good evidence.
Yeah, I 100% agree with you, Jane. The importance of null results, disappointing as they are, is almost as important as getting the positive results as well. But thanks very much for all your contribution, everything you did to help the study in its early days to attract such a large number of participants.
Thank you.
Thanks very much. So I'm now going to go over to Hayley Holt, who at the start of the study was a PhD student working here at Queen Mary. And Hayley, what are the thoughts you'd like to share today?
Yeah, thanks, Adrian. Yeah, so during my PhD training with COVIDENCE UK, I had a unique and hopefully once in a lifetime opportunity to study a disease in real time as it was changing the world. And this project really shaped the last 5 years of my life. And I just wanted to say, firstly, I'm hugely grateful to everybody who participated and joined us on this journey. I think in many ways, for me, I grew up with this study. I was taking on the responsibility of managing a project of this scale as an early career researcher. It was both daunting and transformative for me. And COVIDENCE UK became a training ground, not just for me, but for other medical students and early career researchers. And it was teaching us vital skills in study design, data management, patient recruitment, and communication during a global crisis. And this study for me wasn't just about the research impacts, but it was also about the power of people. I think it brought all of us together to face an extraordinary challenge, and I'm incredibly proud of what we achieved. And again, I just wanted to thank everybody who trusted us and took part and helped to make something truly important possible. So thank you.
Thank you, Hayley. And I'd like to thank you personally for the massive energy you put into setting up the study. Safe, over to you.
Thank you, Aid. I still have a vivid memory of you joining me for lunch in a cafe in Whitechapel and saying, I've just had this great idea, we're going to set up a cohort. And I said, really? Do you realize what a big challenge that is to set up a new cohort study? But here we are 5 years later. You were the driving force, but as you've all acknowledged, we could not have done this without the dedication of all our participants over so many years. So my thanks to them too. One of the conundrums with COVID early on, we realized from studies of severe hospitalized patients that South Asians had a higher risk of more severe disease and death. There wasn't much evidence at the time that they also had a higher risk of getting the infection. So that was one of the conundrums we were determined to try and investigate. And my feeling is that COVIDENCE investigated this question probably more rigorously than any other study. In a nutshell, we looked at risk factors which we know go with being South Asian. Often in cities, they tend to be poorer, they tend to have extended families and to be more overcrowded in their home, which would increase infection risk. They're more likely to be obese. They're often frontline workers, and they tend to have more comorbidities such as heart disease and diabetes. So we examined all of these factors in great detail. But despite allowing for all these risk factors, we still could not explain away the increased risk of COVID infection in South Asians. So disappointing in that respect that we didn't get the answer. I think there's still a challenge out there to try and explain it. I've got some other ideas, but it was an important negative that the sort of standard risk factors did not seem to explain that increased risk. But I think it's important we carry on chasing that link to see if we can understand it better.
Thanks very much, Saif, for highlighting that really important area, and also more generally for your input as a card-carrying epidemiologist. It was really critical to have that epidemiological expertise on the study. And I'm pleased to say we have another epidemiologist with us, Mohammed Talay, and he's going to tell us a little bit about his perspective. Mohammed, over to you.
Hello, everyone. It was a real privilege to be a member of the core team of COVIDENCE UK from the very beginning. We had many interesting findings in our studies of pre and post-vaccination antibody response to SARS-CoV-2. It wasn't easy to select among many interesting findings. I have picked some for you. The story of ethnicity continued. South Asians were at a higher risk of seropositivity and with a higher antibody titer, independent of many other factors included in our models. Obesity showed the same pattern. I mean, obesity was also associated with a higher risk of seropositivity and a higher antibody titer. We also introduced new modifiable risk factors for infections, such as alcohol consumptions and light physical activity. We also identified multiple determinants of antibody response to SARS-CoV-2 vaccines, like, for example, 3 times higher risk of post-vaccination seronegativity for those who self-rated their general health as poor compared to those who rated themselves as excellent, plus many other modifiable risk factors. We also studied breakthrough infections after primary and booster vaccinations, and found factors like to increase the breakthrough risk, such as vaccine type, as everybody knows now, but socioeconomic status, age, education, plus some behavioral factors. I personally was very interested in consistent findings about education and self-rated general health. Thank you very much for your contribution to COVIDENCE UK.
Thanks, and thanks to you, Mohammed, for all your epidemiological expertise and for being the sort of chief number cruncher, certainly at the very beginning of the study. Your input's really appreciated. My privilege. So it's my pleasure to introduce Dr. Paul Pfeffer, who's a consultant in respiratory medicine here at Barts Health NHS Trust, and really provided key clinical inputs into the study, again, from the very outset. So, Paul, your comments.
Thank you. As a clinician, this study and other COVID research has been really important in helping us manage our patients. So as an asthma clinician, we saw a massive drop in asthma exacerbations at the start of the pandemic. But then from approximately mid-2021 onwards, as restrictions lifted, we saw a surge, a rebound in asthma exacerbations. And as a clinician, my big concern was whether COVID itself was causing these exacerbations, and in particular, whether the Omicron variant may have been more triggering of an asthma attack than previous COVID strains. And this is one of the studies that the COVIDENCE collaboration has looked at, in particular, Florence Tideman's paper. And what it did show is that, yes, COVID can cause asthma exacerbations, but the risk of an asthma exacerbation following a COVID infection is no greater than that from any other respiratory virus. And the risk from the Omicron variant was no greater than from any of the other strains of COVID. So although it did teach us that we needed to now consider in this sort of second phase of the pandemic, COVID as a trigger for asthma exacerbations, it also gave us reassurance that this wasn't going to be any worse of an issue than any other respiratory virus triggering exacerbations. And as a clinician at a time of great uncertainty, that type of knowledge was very reassuring and morale boosting as we worked on the clinical front line. So a big thank you to everybody who's put in the data, because without that data, us clinicians wouldn't have had the answers to the questions we needed to answer during the pandemic. So thank you.
Thanks very much, Paul, and thanks to you as well for all the clinical input that you've had from the design of the study right the way through to analysis and reporting. So now on to Giulia Vivaldi, who many of you will be familiar with from previous webinars. Giulia, your comments.
Thanks, Adrian. For me, I think one of the most important moments in my experience of Covidence UK was when we published our findings on long-term symptom profiles. And I think it was a real example of the wealth of information that our participants were willing to share with us, and in particular, the dexterity of the cohort. Because we went into that analysis with the aim of characterizing long COVID in our cohort. But because of all the data that we had and the amazing contributions from our participants, we were actually able to go further and shine a light on post-infection syndromes more generally. And I believe it had a real impact. We received correspondence both from Covidence participants and members of the public, and they were grateful to see their experiences of a slow or difficult recovery after a respiratory infection being talked about in the media, finally being discussed and recognised. And I both hope and believe that our work, along with the work and studies of others, has really contributed to a renewed interest in these conditions. And as a result, I expect to see some really nice, high quality, targeted research on post-infection syndromes more generally. So like everybody else, I am incredibly grateful to our participants, as this research simply wouldn't have been possible without them.
Thanks very much, Giulia, and thanks for all of your invaluable input into running Covidence UK analyses and publishing some really important papers. So before we close, I also would like to highlight that another major contributor to the study, Dr. Annie Williamson, unfortunately wasn't able to join us today due to her medical commitments, but she's recorded a message for you, which will follow now.
Hello, my name's Annie Williamson. I'm a health economist working with Covidence UK and also a doctor in the NHS. I just want to say a huge thank you to all the participants who've made this research possible and who've given their time and their thoughts and commitment over several years. From an economic perspective, this couldn't have been more valuable. We were able to do really transformative research showing that COVID increase the risk of someone falling below the poverty line if they did get sick, and that research has reached the government. It was covered in The Guardian, and it's really put on the agenda the human cost of COVID, but also the need to do something to support people who are in need. So thank you so much. Your time has really made a difference, and we're just all extremely grateful.
Well, thank you very much for that contribution, Annie, and for everything you've done to inform our health economic analyses on the Covidence UK study. And so this now brings this final webinar to a close. Just to clarify what will happen next, if you're a participant who has asthma and who is also signed up to the new nasal swab study, you will continue to receive monthly questionnaires into 2025, which will then be linked into the results of your nasal swab tests for respiratory viruses in 2025. However, if you're not a participant in that sub-study, then today's will be your final monthly questionnaire. And it just falls to me to say a massive thank you to all of you for everything that you've done to support Covidence UK over the last 5 years. I think the contributions you've made have really demonstrated the power of what citizen scientists can achieve. So thank you from the bottom of my heart. From all of us here at Covidence UK, goodbye.